Hi, it's Katie again. This is the day after surgery. Hospitals and doctors call this day 2. Day 2 and day 3 are supposed to be the most uncomfortable, the worst for swelling, pain, and bruising all setting in. I want to tell you a little bit about how last night unfolded since I last talked. I continued to vomit every 2 hours all night long as we kept up the trauma set. And a bit of my history is that Tramadol, I'm sorry. I get those mixed up all the time. My history has been that narcotics make me throw up. And usually people, doctors, nurses will say, combine it with Gravol, the anti-nausea, and that it'll be just fine. And as we found out once again last night, we could take top dose of Gravol along with the narcotic for pain and still be throwing up. And it started to really hurt my stomach by about 3 in the morning. That was starting to become a real issue to me. When I wasn't throwing up, still very comfortable, very groggy, as you saw in my last video. And by 6 a.m., we called the number the doctor left for us and woke him up, Kevin did, and said, at this point, it's not a pain issue, it's the throwing up that's the hardest thing, and I was starting to get a migraine from throwing up so much. And he advised and went along with our suggestions of drop the Tramadol. Can I do it again? Tramadol. Drop the Tramadol and stop taking the Gravol. Oh, take one more dose of Gravol just to settle it, and then drop the Gravol and just do a Tylenol, an extra strength Tylenol, since my pain was really low. And that worked right away. I haven't thrown up since, and I was able to drink a lot more, and even I've had a bit of a muffin now. It's 3 p.m. if I haven't said that already. Much more comfortable. So if you have sensitivities to narcotics, you might have to play around with that even earlier than I did, because I didn't need a night of throwing up, that's for sure.
Boost.
Oh, and it seemed like I tried to take the boost thinking that would help my migraine. I thought migraine was maybe because I was just out of goodies in my body, out of food. And when I took the boost, it made everything worse. The milk seems to activate on the anesthetic residues in my body, and it made me throw up even worse. So there's the other thing, the boost should have waited. So now I'm on just an extra strength Tylenol, not T3s or anything. Very comfortable, about level 2 out of 10 for pain. Still my breasts just mostly feel like I did a good workout at the gym doing fly workouts kind of thing. It's just that kind of, oh, my muscles are aching, I'm tender a little bit, but not sore at all. If it was just my breasts had been done, the enhancement, I don't think I would even be having to take Tylenol. My stomach still feels like really strong period cramps, and when I move or change position, it'll kind of twinge a little bit and then settle down quite quickly. I'm walking around pretty good, a little bit hunched over. What else did I hope to say, Kevin? Was that about all, I think? Tomorrow's supposed to be like top for pain and stuff, so it'll be easy and interesting to see how that unfolds. And as far as advice, I would just advise to really use your doctor's call line that he gives you when you leave if you have questions, because we probably should have done that about midnight and saved ourselves a sleepless, very hard night. And that's all for now.